And I think we actually need to have a mindset about what will you do to take personal responsibility for your health and the health of others. And it will involve mask wearing and maybe certain venues or activities that there'll only be vaccinated persons able to attend. And whilst people may say that's harsh, dealing with a pandemic is fairly harsh, and also we don't want to overload our health system, but also importantly, we don't want to spread the virus to others who might be harmed. I think that's probably the main message at the moment is to get vaccinated, as the Minister has said, but don't forget that that's going to take, if you are getting your first dose, it takes a couple of weeks to get the antibodies up in your blood. I've said that before. It also pertains to the second dose and the booster. And the timing of the booster may change to an earlier interval, but it's still, the protection is there when you are fully vaccinated. And we're going to be living in this way over a period of time, because this will be endemic and we'll have to have these sorts of responses, hopefully a more targeted one in the future. Thank you.
Thank you, Dr. Heggie. Unfortunate news for Tennant Creek and Ali Crung, but I would continue to encourage you to come forward and help us with the testing. We are expecting a significant number of results over the next 24 hours, and we're really relying on that to guide what the future days may hold in store. To Alice Springs, a preemptive step, good public health advice from the Chief Health Officer about the fact that the mask mandate should be in place, particularly given the number of people we know are milling in and around Alice Springs at the moment who'll be using the shopping centres. They are central places for a service town such as Alice Springs, and we think it's important given some of the early movements we understand have occurred with the close contacts that have subsequently turned positive. We've got resources continuing to be on the ground. We've got police officers, health staff and others literally sleeping on swags on the ground and the like out in some of the remote parts of the Northern Territory trying to provide assistance and support. We've been visiting remote outstations where there's been some linkages to close contacts. We're continuing to prioritise assessments to determine a person's positivity or not, and ensuring that they've got access to the best care we can possibly provide. There's a lot of significant effort going on, and it really is a testament to all people involved. The conditions are still relatively warm, that we're dealing with a lot more vehicle traffic. There's a lot of people who have entered the Northern Territory, not just by road, but by air, and a lot of people are moving around because of the freedoms that have come into place since the 20th of December. All of it swings back to the human contract, the contract we need to have with you to continue to help us to help you. Just be conscious that if you need to wear a mask, wear it. We really don't want to be in a position, certainly this close to Christmas, to be issuing infringement notices for non-compliance. It's a simple request. It's not that detrimental an impact to ask you just to pop a mask on if you're going to head into the shopping centre and be in amongst an area that's highly populated. It's a safety precaution, and it's one that we hope will ensure that all of you can be around the dinner table or wherever you choose to celebrate Christmas on Christmas Day. The work that's continuing is such that we need to make sure that we're moving all the tests we possibly can into our testing facilities. So we've got a lot of airline charter flights and the like who are helping out. We're moving as many tests as we can. We are conscious of the urgency of trying to give you a definitive position for what Christmas Day may look like for you. Again, in the interim, the vaccination teams are on the ground in those relevant communities, but more broadly, to any of those remote communities that have still got some reluctance, we do urge you to come forward. Mobility at this time of year is high. We're going to start seeing some weather events start to impact that may restrict that. Take the time while you can, while we've got the resources on the ground who can provide the vaccine for you to get it done. It may well help minimise you and your family becoming critically unwell.